I'd like to ask the panel this. The fact that many of the things that worry us as outcomes are functional deficits, reduced sperm count, neurobehavioral deficits, these are things that are not currently systematically tested for in regulatory regimes. They much more acute toxicity, multi-generational effects, looking for gross malformations, often detected either by X-ray or naked eye. We're missing the fact that what we need is assays for detecting these functional deficits, such as Nick and other people look for in their animal models. That's a problem, isn't it?
That's right. Yes, I have to answer the question. When we think in humans in long-term effects, what we think is in epidemiology and how things happen together in the same time, at the same time in the same place. Database on disease, incidence, prevalence, and mortality of functional deficit and fertility, together with use of chemical or human exposure during the times. When Miquel referred to this cohort effect, is something that I learned from him and from the other epidemiologists, is that when you are at age 60, you were exposed during your life, and there are people at the same age that maybe happen for the same windows of exposure, critical exposure for contamination that were especially important at the time that you have this age. Then we need this complex approach that he knows much better than me to identify the cohort effect. Contamination, exposure, and windows of susceptibility at the time of contamination. But you need, good data, good follow-up, and good expertise. I don't know how to translate that in animal experimentation or the follow-up of in lab or in animal experimentation of a population. I don't know. I have no experience.
Yeah, I guess the thing is that we want those, what you're talking about is after the event, and what we want to be able to do in regulating new chemicals is to detect, potentially trap them earlier on.
That's right.
And we don't have that in place at the minute. That's the thing, and that's where we need to be moving towards.
Let me tell you something. We have something that is experience. Tomorrow, someone will present a book that is late lesson and early warnings. That is experience. If something happened before, will happen again. Okay.
There is another side of the experience, and this will seem very far away to you, but it is not. Another dimension is that our societies do very poorly at measuring, visualizing, assessing, appreciating, giving value to policies that did good, that produced immense benefits that are inherently invisible unless you have monitoring systems. And lead is the fantastic example. Huge increase in the intelligence of children with huge beneficial consequences, which are only measured economically, although they had profound effects on the possibility of human development. In the middle of the crisis, I am surprised at how little we've talked about the crisis today so far, with all the stock markets being upside down and so on. In the middle of the crisis, I think we should think and do much better at explaining policies that worked, at explaining why they worked, perhaps in a semi-quantitative fashion, because you don't always have perfect data. And then this, Nicolas, will always help that certain failures are not repeated. Because we think that when you have a good sensitive assay in the lab, someone in l'Élysée or in 10 Downing Street will immediately change policies. And what our papers never change the policy. policies change for other reasons that we have no idea because, well, unless some of you have degrees in policy science and so on. But scientists are very dumb. We think that because we write a paper, things will change. And things change sometimes because we make huge mistakes as DES and thalidomide and Seveso and so on. And sometimes they change because they persuade people that it is worth recycling, paying taxes, you know, substituting products and so on.
I have to put some 2 cents worth in here as well. It's very true that policy doesn't only change because the right science came along and people said, oh, okay, that's obvious, let's just go ahead and do that. Yes, the tests are missing. The discussions have started for some things. What we do see is that these discussions aren't going very well. One example would be a test in the European Chemicals Agency about endocrine disrupting chemicals. Or actually it's a test on reproductive toxicity and whether it picks up EDC effects. Because the REACH law has a particular phrasing, the question was put before the Commission and the Member States. They had a discussion about it, they had a subgroup discussion about it, they put up a document, they put it back to the Commission scratched their head and said, well, we're still not too sure. They went off and they did a legal study, and long story short, the most recent discussion that was had with the Commission and the Member States, where the Member States had really told the Commission, we like this new test, we know it isn't exactly what was in REACH, but we think it will work. With these and these provisos, go off and get it in the EU regulation that would allow it to get then put into the REACH legislation. And the Commission said, no, we have to go talk to somebody else. And somebody else they wanted to talk to was the Risk Assessment Committee of the European Chemicals Agency. So we have a very convoluted way of getting these discussions finished. And it's a real problem. My job is to help get those discussions moving better. And I don't have any perfect solutions. But I will say that in my experience in Brussels, it does help when scientists come and not only express what they do and do not know about the science, but where they feel the process needs to go. That makes a difference. Thank you.
Argelia.
Bueno, nada, solo fuerte. Yo quería señalar, varios aspectos.
My fault.
Sorry, because you just
Sorry, it's my fault.
to me in Spanish and then I just replied directly. Sorry very much. So I just refer to issues that you have touched in different talks. I like to support you when you say at the beginning of your talk that scientists, that we have to transmit to our representatives for the next parliament meeting, whatever. It's not an isolated case. It's just in general the scientist has to transmit this to those who are represented. Okay, everybody, every of us who have been working in research knows that measuring exposure and single chemical is nothing, but we have to start with something. Everybody knows also that the most appropriate is, of course, to measure biomarkers of effect. This is really what we need to do when we like to really make biomonitoring of the population to measure effects. But this is going to be incredibly complicated. We have to put together the legislation with this, because of course industry will like to find the way to escape for something. So as much as windows you leave, as much easier for the industries to escape. So if you say we have detected a particular effect, but this is not true, we have particular exposure of chemical, no one will be guilty of that. So it's quite complicated situation in the way to go ahead. So then the physiological test that you are talking about. So the regulation, the putting all the new tests in the regulation is extremely slow, extremely complicated. So I think that the community has a lot of experience in different issues, and all the things should be, in a way, pushing at the same time, demonstrating that human biomonitoring should be a tool to look for implementation of any policy, whatever, look for trying to go ahead with biomonitoring and biomarkers of effect, and then try to not leave small windows for the industry to escape to that, and then transmit from the scientific work to our representative to the parliament. I think in the last biomonitoring week in Brussels, we were talking about mercury. So now we are in the middle of the negotiation, the UNEP Treaty for mercury. One of the points for this is the inclusion of human biomonitoring as an implementation tool for, of course, the legal instrument. I was in Nairobi, so it's so complicated, the legislation for a scientist, that just changing in the way that the law is applying, that can save a government or to not make a particular thing. For example, if in the clause G, they don't say that it has to be human biomonitoring to control the implementation of the treaty, in the way that you put the words there, then it will be obligation or not obligation. So as soon as there will not be obligation, no country will pay money for accomplish something. So if we as a scientist will not be able to transmit to our representatives how the things have to be done, it is impossible to change the law, because it's many complicated things at the same level.
I'd like to just respond. Yes, it is awfully complicated, but there are lots of other complicated things we do as a society, so it's not, I don't want to make it sound harder than it is. The other thing I would say is some of what we need to do is to catch up on things that were done differently in the past and we haven't yet resolved. Like the fact that there are a lot of chemicals out there that we're not doing biomonitoring on, that we don't necessarily have the biomarkers for, just the presence of, not even the effect. Why don't we also have the proposal for a law that says you cannot put a new substance on the market unless you have developed a method by which to have the biomarker of exposure in a human body? That to me seems, yes, we still have to do the catch-up for all the old chemicals, and yes, we have an awful lot of old chemicals. We still don't even really know how many we have in the EU. We've got some idea coming along with REACH, but there are lots that are exempt. But we can, at the same time that we are taking care of our past problems, or trying to take care of them, start making better, more ambitious demands of how to go forward as well.
Lisette, could you just explain for the non-scientists here exactly what you mean and everybody means when they say biomarkers?
Yeah, me not being a scientist, I'm not going to have to explain it in a way that might be scientifically accurate. A biomarker is a way in which you tell that the substance, for instance, is in the body. The discussion in human biomonitoring is, are you looking for the way that chemical shows up in the body because it's just come in, or are you looking for the way that chemical shows up because it's actually made a difference in your body? So that's the difference between a biomarker of exposure versus a biomarker of effect, where you've actually started changing maybe the endocrine signaling in the body, or the way in which the cells respond to their normal functions.
Yeah. What struck me with listening to some of the chemicals talks and your graphs was, and that's a part that we need to always keep in mind, is the system, how our system is set up and is working, how the reward system is working. Now that you made a reference to the financial markets again, Because what strikes me is when you showed the graph with the old age class people having so many pops in there, well, at least the good news is they're still alive, okay? Even though they have 10 or something high concentration of these pops in there, they seem to have life signs, at least, okay? I don't know in what condition they were, but they were not declared dead, otherwise they wouldn't be in your... So, and this leaves now, of course, if you look at it from a business perspective, and the policy and the reward system, this is the best clientele for the pharmaceutical companies. You know, the system fell in place to be that getting chronically ill, sublethally chronically ill, aging people are the best clients and the best profiteering for pharmaceutical companies. It's bad for our health systems, and that's the system that collapsed. But, you know, the reward system is the way that we make a lot of money with them. And isn't that something that needs to be taken into account? Because you hear immediately, I'm sure you've heard that people say we're getting older year by year. Our population is getting reaching ages that...
Well, you say many things. One is be careful before you ascribe to your companies or industrial sector successes like the increase in health expectancy. Please be modest, because this is something that is due to other factors. Better living. No. I'm talking to people who easily will say, well, it is thanks to blah, blah, blah. The other thing is, okay, even if everybody contributed a little bit to the increase in life expectancy and quality of life, don't you see that there is a bill, a heavy toll that we're paying? Don't you see it? Because I'm sure you know somebody with diabetes, infertility, cancer at age 14 or 40, Alzheimer's, Parkinson. Don't you know? I'm sure you know that there is a bill, except that the bill we don't make it visible because the connections, because there is a lot of people interested in not making the causal connections between, you know, how we live and the bill that we pay. However, industry, 99% of the times that has been mentioned today, if not 100%, has been criticized. And I think this is wrong. And I think that you may be true in what you were saying, the system is perverse and so on and so forth, but I don't think it's true. I think there is another option. I think, as Kahneman would say, that you have your frame and then we put the facts there and they fit together. But there is a lot of encouragement, there is a lot of incentives to do things well, to really get benefits to people. Citizens don't buy stupid things all the time. If you offer them something healthy, they will try to buy it if they can. And what about the huge benefits of companies that do things well? Why don't we measure that? And what about the many wrong things that scientists and governments and citizens do? What about all the contradictions in citizens? In a country that has such poor rates of recycling, for instance, you know, you can blame politicians all the time, as we do in Spain every day. But what about companies and organizations and, in other words, in public and private policies that do good, that stays invisible because the system doesn't have the indicators or the social organizations that want to care about somehow measuring the human benefits of all those policies. And the pharmaceutical industry, I wish other sectors of the chemical industry were as positively regulated and with policies, you know, in the meta-analysis that we do with clinical trials. It would be impossible to leave out studies that comply or do not comply with all this GLP thing. It got me hallucinating this morning, although I knew a little bit about it. But in medical research, with all the problems that medical research has, you don't see that type of thing. So I think it is not a good idea to focus only, you know, to blame industry all the time. And it is important in the middle of the crisis. I'm not saying you were doing that. I was just using your... In the middle of the crisis, it is very important to say, listen, because otherwise, one of the most perverse false. Because if it is perverse and true, we have to accept perversion. But perverse and false dichotomies is economic growth and profits for companies and jobs versus health and environment. And this is false.
I agree completely, but this actually confirms what I said, that the reward system is not geared right now towards the way that the companies, well, when you say there is so many benefits also, and there's organizations who do good and policy response who do good, well, the reason why we don't know about it is there's lacking monitoring, it's lacking communication, and it's lacking a reward that goes to recognize the rewards and attribute this, the benefits to these companies, and maybe that could be something we should be changing as well, or work towards to not do the blame and shame game only, but also do the reward game, or the whatever the term is in English, and say this is a good model, this is how it should work. This is exactly what. But I come from Switzerland. Maybe that's my bias. We live off the profits in that country of the pharmaceutical companies, and then we have companies that bring drugs on the market like Tamiflu, where nobody knows whether it's actually working or not, but we're generating a lot of profits with that, So that's where that angle comes from.
It would be nice to end the discussion. So I'm there's two persons that still have questions. Could they make them fast, and then you all answer?
I only wanted to add to this issue a short thing, as without questioning the point you were making, there is a great difference between when we are talking about human health and environmental health. And that may be a source of difference of companies. We as people tend to care about our own health much more than for environmental health, which is perverse. Actually, safety regulations for pesticides or for chemicals should be more strict, more severe, in my opinion, than human health requirements. Because what happens, if we get poisoned, then we die. But if we, as with persistent contaminants, contaminate our environment, then we create a long-term problem. Pharmaceutical companies depend on their consumers, and the consumers care about human health more. So that's why experience with pharmaceutical companies may be better. In my experience, well, maybe there are examples, but I'm not aware of one, when a pesticide company would voluntarily withdraw a single active ingredient without any legal pressure, because they would simply not give up the profit that can be realized until the substance is banned.
Okay, two fast questions, José Vicente, and then...
Thank you. Well, first a comment also with the discussion this morning. I assume that you were talking about the OECD extended one generation the test. That is, again, one of the confirmation that the system can be lengthy, but nevertheless, we are talking about an OECD test that has been modified, agreed a few months ago, based on the input of scientists that requested additional information on neurotoxic effects, immunotoxic effects, and so on. So there is that possibility. And I have a specific question for the panel. Now you have available information in the ECA web page for about 5,000 chemicals, with all the hazard information that has been provided, and also all the uses, with descriptor for the uses for all those chemicals in the EU market. Do you feel that that information can be used to select the chemicals that need to be set in the priority list for biomonitoring, for checking the exposure of humans as well as the environment? That has this information have an add value for the scientific community or not?
Yeah, there was a question regarding bisphenol A and the lady from HEAL. I was wondering, historically, we've had the science, and the science has been good enough to provide early warnings. What has been lacking is kind of the political action taken on the science. And I was wondering, how do you see that? Do you see mechanisms on how we can kind of progress political action being taken and not just keep discussing the science?
Okay. I'll take Arizona's question first about the EU GRTS, as it's known. Yes, the test was recently approved at OECD level, but if the EU continues, the EU altogether, ECHA and its member states and EU, if they continue at this speed to take their time about when they will decide that this test can be used, we will have, under the REACH legislation, run out of the time by which we can give that test to companies and have them use it for their chemicals. ECHA is under a timeline, and at this point it's playing against us to get the endocrine disrupting properties of these substances taken up if we don't get that done within that timeline. So that's a real problem. Asking for more information and more information when we've got a clock ticking doesn't work. With respect to the 5,000 chemicals on the database and the uses descriptor, I'm not sure if I can answer your question about how useful that is for selecting chemicals for human biomonitoring per se. What I will say is that every time that I have gone into the website and tried to look up particular chemicals, I have ended up really confused. There are gaps there. I don't know if those gaps are there because the companies requested for that information to be confidential and the confidentiality request was accepted, or it's still in process, or whatever it is. There's all kinds of issues about how hard it is to navigate into that data website. And then we find that when you try and look at some of these use descriptors, for instance, for an issue that is now becoming current in Spain, which is it's got a long name, the hydrological fracturing of shale rock for natural gas. If you try and go into that system and find out which chemicals are being used for fracking, you can't figure out which of the overgeneralized use descriptors may or may not even apply to that particular use and what chemicals are being used. Maybe they haven't been reported yet, maybe they're there and they're under a different name, you have no idea. So there's that, and there's the fact that we know from ECHA's own pronouncements that a lot of companies have turned in dossiers that are highly problematic. Quality is bad, there's all kinds of things missing. So we have various problems with the system, which I guess leads into the question that this gentleman was talking about, which is when you've already had quite a long time of the scientific evidence, but you're not having that triggering early political action. Yes, I think there are things we can do, but those are new generations of political demands. And the new generation of political demands would be not undergoing a full-blown risk assessment before you take action on a chemical, but saying, if we have a series of 5 or 6 studies from the independents and X number of studies from the industry or whatever grouping you choose, at that point some preliminary action has to be taken that may be reversible at a future date in order to ascertain population exposure and reduce that exposure. I think there are these new generation political demands. We haven't gotten to the point of getting that kind of stuff embedded in law yet. We're still grappling with that. REACH was an attempt to do that in the sense that we were reversing a system of never having the information to a system where we have all the information. What we find is that it's taking a lot longer to implement than we thought, and we are to some extent snowed under too much information and the length of the procedures that's required to sort through that information. So I think that there's still some innovative thinking that needs to be done about getting the political triggers for early action without the old-fashioned paralysis by analysis.